And thank you for the Skills Council for inviting me here to speak today on the Nursing Home Oral and Dental Health Plan. As today's forum focuses on workforce, my presentation will mostly focus on training under that plan. It's quite fitting that I'm here presenting this for the first time in South Australia, because a lot of the work has actually originated in South Australia, and we plan to build on that work. And this has been work that's been done over a long period of time with some really dedicated people to form something that is based on very solid evidence, and that's what we're going to be taking out to rolling out across Australia. The overall plan was prompted by public concern about the quality of oral and dental health for residents in aged care homes. And as Clive has rightly pointed out, there is a problem in residential aged care homes, and it is time to do something about it. And so around $3 million has been allocated to improve assessment, care planning and the quality of oral hygiene for our residents. And that's just the start of what we plan to do in terms of working with the Skills Councils and other areas as well. But there is something that we needed to do immediately, and this is what we've put together. At this point, it's really important for us to emphasise that this is not about or intended to replace dental services. This is about upskilling our people who work in residential aged care, people who know our residents on a day-to-day basis, in how to help them with their oral hygiene, just as a mother learns how to clean her children's teeth. And I'm not saying that our care workers don't do that now, but what's surprising is that the number of care workers that are being trained in this program to date, it's amazing to hear them say, oh look, that's so simple and I didn't know that. So yes, there is training required, but it may not be as complex as we think it is, and we may be able to take it further quite easily. The training component, which I'll focus on today, aims to provide an increased awareness of oral hygiene, and that's actually one of the things, and I think reflecting on Martin's name of his presentation today is putting the mouth back in the body. I think that's a really important part, is that we actually just raise the awareness of the fact that this is an area where people have to put more time. And that's really for our staff that are dealing with the residents. And as I said before, it's really these people that know our residents very, very well. They're with them on a day-to-day basis. The plan itself has 3 objectives. First of all, we're looking at strengthening assessment undertaken as part of entry into residential aged care. That's also assessment to determine whether someone's going to have a community package or whether they're going to go into residential aged care. To strengthen the skill base of residential aged care workers by rolling out the resources that have been developed through the Better Oral Health in Residential Care project, which is the South Australian project, and I'll be talking more about that. And to strengthen the processes for monitoring the quality of care for dental and oral health in residential aged care by reviewing the accreditation processes and the Accreditation Standards, which Dawn referred to before. Although this is not my area, I'll just give you a very brief overview of the work that's been conducted around strengthening assessments undertaken by the ACAT teams. And this is to determine the level and type of care a person is eligible for, either in the community or the entry into residential aged care. Make sure I'm on the right slide. Oh, did I? Oh, no, here, no, that's right, I'm there. So first of all, there's a set of validated tools for comprehensive assessment that is being developed to be used by the ACAT teams. The set of tools will be appropriate for use in the community, residential or acute health settings, and will include a dental health assessment tool. The dental health assessment tool will provide documentation of dental concerns, a baseline of the person's dental health status, and will trigger referral for a further dental examination if needed. The department has established an informal expert clinical reference group to provide expert clinical advice on the selection of the recommended tools. This group held its first meeting in June this year, and it's about to meet again next week. It's expected that the final set of tools will be available for use by ACATs at the commencement of the 2010-2011 year, and training in the application of the assessment tools will be delivered under the ACAT National Training Strategy. Another piece of work that I actually have carriage of is the review of the aged care accreditation standards. The review of the process and the accreditation standards are being progressed in parallel. In the current standards, and Dawn pointed to this before, outcome standard 2.15 of the Aged Care Principles under the Aged Care Act require that approved providers have in place processes to ensure that residents' oral and dental health is maintained. In addition, outcome 2 states that residents are to be referred to appropriate health professionals in accordance with the residents' needs and preferences. And I think the important thing that we need to recognise here is that residents have choices around what they do here, and so do their families. You know, some residents can't speak for themselves, and they have family members who do, and there are often situations where residents or their families refuse to have anything done. So we can only have a standard to guide. It's not actually totally enforceable when you look at the fact that we do have a standard around resident choice as well. We've held consultations with relevant aged care bodies and parts of the dental sector and the Aged Care Standards and Accreditation Agency, both around this work and about the plan in total. We recently conducted a request for tender process to engage a consultant to undertake the review, and oral health will be part of that process. That standard will be reviewed along with the others to strengthen it in the review of the standards. But the one I'm mostly interested in talking about today is to strengthen the skill base of residential aged care workers. We've recently conducted an open funding round to engage registered training organisations to deliver the national training package. We're now in the process of negotiating with a number of RTOs to deliver the training to up to 2 registered nurses or identified training staff in all government-funded aged care facilities, multi-purpose services and Indigenous flexible services across Australia. This process will be assisted with additional support for those in remote areas through electronic delivery. We're going to be working with the Aged Care Channel, and the program that they have at the moment is being updated to reflect the national face-to-face training as well. This is hands-on training. This is training where you'll have registered nurses that will receive the training to take back into the residential aged care facility to train the other staff within the residential aged care facility, and I'll tell you more about that. The training will address oral health assessments by RNs and general practitioners, and this is again the work that Martin referred to earlier with the OHAT, the oral health assessment tool, and that is going to be part of this training. The oral health care planning by RNs, the daily oral hygiene by care workers, and the dental referral pathways to dental professionals. The training is based on the South Australian Dental Service Project, which was part of the Encouraging Best Practice in Residential Aged Care program. The dental project has been successful in 3 states in Australia, and you know, I've been very impressed with the work that they've done. The EBRAC project itself, which is the Encouraging Best Practice in Residential Aged Care, was really born out of the fact that while we recognise that existing evidence-based guidelines were out there in the industry, there's a need to establish strategies to translate this evidence into everyday practice. Therefore, the aim of EBRAC was to fund organisations to form consortiums to translate the best available evidence in the clinical area into easy approaches for staff to use in their everyday practice. These approaches could be as simple as strategies in training programs, improved communication, procedures, assessment tools, or management policies and protocols. And you know, the thing I liked the most about the oral health project that we funded in this area was that it was very simple. It's a very important aspect of the strategy for it to be able to be undertaken in residential aged care.